Hi, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation. Today with world-renowned surgeon and vascular birthmarks expert, Dr. Milton Waner, and this year's 2018 Physician of the Year, Vascular Anomalies expert, Dr. Teresa O. Welcome to our October session. Hi, April. I see April's on. Thank you for joining. And, Mahela's on too. Hi, Mahela. And we will take any questions related to vascular birthmarks. I hope some of you will see this weekend. We have our free conference and clinic at the Lenox Hill Hospital, where Dr. Waner and Dr. O are both practicing. And so we'll take your questions as soon as you have them. But thanks for, and so welcome.
Thank you.
Welcome, Dr. Waner. And we're very excited that you'll be this year's Physician of the Year. We're very proud that you are the leading female surgeon in the world for vascular anomalies. That's exciting, right?
Excellent.
It is. Okay, so hi, Mahela. Well, hello. Would you ask your questions? We're ready. Nikki Andrews, hello. How are you? We're ready to take your questions. We have 1 hour. We end exactly at 6 o'clock sharp. So as soon as you can type your questions, let me just make sure I'm not missing any.
Do we have time for a word from the sponsor?
Our sponsor is
VBF.
the VBF. That's right. Yep. Thank you all. I can see some others are coming on, and let me just get this. Oh, hi, Tiffany. What is the newest laser for treatment of port wine stain?
You know, unfortunately, our treatment of port wine stains has not changed much over the last few years. In fact, you know, every few years a new laser comes in and we expect good results, but this is not borne out. Essentially, the results are the same. So the pulse dye laser is the gold standard laser for the treatment of port wine stains, and that really hasn't changed for a long time. And I don't see anything on the horizon. There was some research coming out of China which showed that something called photodynamic therapy was very interesting, but unfortunately it hasn't panned out yet.
Well, hello, Mariska from the Netherlands, and Amanda McSorley said, hi, Dr. Waner and Dr. O, sending lots of thanks for your work with Megan from Ireland in 2015. Mark Andrews, hi, Mark, how are you? Bears fan joined. So let's take your questions regarding vascular birthmarks. We have 20 people on right now, so let's get your questions. They're probably typing them. We're not seeing them, and they're all going to come in. Treatment questions, protocols, hemangiomas, port wines, lymphatics, venous, various syndrome questions. Oh, I see some questions are coming in. So let's see. Aaron joined us. Michelle, what age do you recommend starting laser? Renee
Okay.
Garrett joined. Hi, Renee.
So the age to start laser treatment is variable, and it depends on who you go to. We believe in early treatment. The earlier, the better. So you can do very early treatment in the first few weeks of life without an anesthetic. Obviously, if you need an anesthetic, it's going to go out till it's safe to do an anesthetic. But the emphasis is on early treatment. We really believe in early treatment. And not only that, the first treatment is the most important. The first is by far the most important because you see the most benefit from that very, very first treatment.
Great.
So
But we're
early
still
and
talking about port wine stains.
Yes.
correct.
yes.
This is port wine stains.
Hello, Renee. We'll miss you this weekend. We were hoping you'd be here. Mariska said, what would you suggest as treatment for a vascular, and this will be for you, vascular malformation behind the eyeball?
I think that it really depends on the kind. Is it venous, lymphatic, AVM, what the extent of the lesion is. If it's very small, a quick surgical excision is possible. If it's more extensive in the entire orbital space or involving muscles, we might consider sclerotherapy. And, you know, Erin Fay has done a lot of these procedures in the past where you place a fine needle under image guidance and inject sclerosants such as bleomycin. So we've had really good results for venous malformations and lymphatic malformations being treated in that fashion.
Okay, so Vin wants to know, he has a thick area on his port wine stain, and he wants to know if the pulse dye laser is appropriate or should they try a different one for the thick area.
Okay, so when you say a thick area, do you mean the tissue is thick?
He says it's thicker than the rest of the stain.
Okay, generally for that type of thickening, surgery is what's appropriate because it's thickened because there's been tissue overgrowth. The tissue has become very thick. All the layers of tissue, not just the vascularity, has become very thick. So we generally perform surgery for that. People have tried various types of lasers, but unfortunately it's not been successful.
Okay, so Nikki says they have unconfirmed KTS, and would a laser work on a patchy area?
Yes, we do perform laser for different areas of KTS. We use the pulse dye laser, similar to what we use for port wine stains on any red staining. Sometimes in areas where the vascular malformation is a little more thickened, we may have to use YAG laser as well.
Okay, so Jennifer wants to know, do you recommend to vary pulse duration for treatments? What are the benefits to vary it, especially a small child? Her daughter's 22 and has already had 13 treatments. She feels like they're hitting a plateau.
Okay, so to answer the second part first, yes, it's very common to hit a plateau. You get to a point where you see almost no improvement. That indicates that you've reached a maximum. That's the maximum amount of benefit that you're going to get. Now, is there any indication for varying the pulse width? We've not seen any scientific data which validates that. In other words, there's no proof that varying the pulse width is going to do anything. Doctors have tried that, but we've not seen any data. So typically we say if you hit a brick wall, that's the limit of what current technology
For the
do.
time,
For the time, yeah.
right. So Renee Garrett, who you both know, she wants to know, Dr. O, when the malformation is wrapped around the optic nerve, is there any other treatment other than surgery?
Yes, sclerotherapy. So this would be a procedure where a needle is placed into the orbital space and we inject a sclerosant, which is a medication to try to shrink the vessels or cause fibrosis of the vessels. And recently we've been using a medication called bleomycin. It's been very effective.
And bleomycin, Renee, does not cause the swelling that the other agents do. So that's the safety. Because in the past, when we've used other agents, there's been swelling, and the swelling can cause blindness.
Okay.
Bleomycin does not do that.
So we have 16 questions pending, so we got to get through these. So Holly says her son's been on propranolol for nearly a year for his hemangioma. It started to fade. It's flat, but still quite prominent. Do you think it's likely to start fading more quickly anytime soon, or do you think it will remain as it is now?
So it depends what kind of hemangioma it is. Is it a focal or a segmental? Meaning, is it like a round cherry? Or is it something that's more diffuse? Because we know that the more diffuse or segmental ones can grow for much longer. It sounds from the description that it's probably a focal or a cherry-like hemangioma, and it could be that there is some residual thickness. I think at this point, the propranolol probably is not as effective, and we would probably stop the medication at this point. You could, depending on how prominent that thickness is, you could wait and observe and see what happens over the next months to year, or you could do a thinning procedure depending on where it is, how thick it is, and how prominent it is.
Okay, so we have 22 people in queue. So Alex Exner met you at the Amsterdam meeting, Dr. Waner, and he said his daughter has an AVM on her finger and now it's an open wound. So he wants to know what should be done about that.
Okay, so this is a problem, and she's going to need to be seen. Embolization can sometimes help, but generally it's not helpful, and it depends on how bad the wound is. I'll be in Berlin in November, early November, and if he wants, he can email. You can email me, and I will arrange to see her when I'm in Berlin.
It's great. There's a lot of people saying hi, but we got a big queue. So Laura says her daughter has a large segmental hemangioma on her scalp, now 2 years old, was on propranolol 12 months. It's basically gone. However, veins leading to it now, involuted, are still very blue and noticeable. Would laser help with that? With some prominent vessels that are left behind?
You know, those veins are usually quite large, and they don't typically respond to laser treatment. If it's on a visible part of the scalp, we can sclerose, we can do YAG laser treatment, but pulse dye laser doesn't typically work. If it's on a part of the scalp that's covered by hair, then we typically don't do anything about it.
So Alexandra has a good question. Her child is 3 months old and has been having laser treatments every 4 weeks. In your opinion, like, when should they start seeing noticeable clearance, and should they have seen it by now? So her daughter's 3 months, so she's had 3 of them, one every 4 weeks.
And what kind of lesion did she have?
Port wine stain.
So we should see some result by now after 3 treatments, and especially after the first or the
Right.
second, I would say.
Yeah.
I would want to see what kind of laser settings are being used, and how
I
the
mean,
laser treatment has been.
just to chip in on that, I mean, one of two things is happening. If the treatment is adequate, then it's one of those that doesn't respond. If the treatment is inadequate, then that's the explanation.
I'm sorry, Yasmira, that you don't understand our English, but maybe you can get somebody to translate this for you. Marissa says, thank God our daughter has a combination of venous and lymphatic on the right side of her face and neck. She had several sclerotherapies with bleomycin. Our surgeon is hesitant to do anything because of the location. We're afraid of bleeding behind the eyeball if nothing is done. But alternative, damage from hitting a nerve while injecting is also scary.
The likelihood of hitting a nerve is very, very low, extremely low. In fact, the way it's done is they fuse the MRI and the CT, and you can tell and advance the needle a millimeter at a time, and it's possible to sclerose cysts that sit right on the optic nerve without damaging the nerve. So it's very important that this is not done blindly, but it's done at a center where they're capable of doing this and they know how to do this. It's something that can be done, and the optic nerve can be avoided.
So Dr. O, this is a good question for you. When port wine stain tissue is removed, is there a
Yes.
chance that that thickened tissue can come back?
Yes, we know that all vascular malformations do continue to grow over time. And what we're doing when we do surgery is to create symmetry and to improve quality of life. So yes, over time, that residual port wine stain tissue does continue to grow, because we find that there is a growth signal abnormality in that dermatome, or that segment of port wine stain that involves the bone, the muscle, the fat, the skin. And so we're thinning it out, but over time it will.
So Rufinok has a very powerful and important question. Has an AVM on the tongue, the lip, the maxillary sinus, the left cheek, ophthalmic veins, 16 interventions, 6 embolizations. Is the end of this help possible? Is there any hope for these complex AVM malformations with multiple procedures?
Well, Dr. O is doing some research on certain drugs, and there is a combination of drugs which she knows about and is using, which has been extremely promising. Unfortunately, we'd have to see the patient to be able to determine whether this is possible. But for these very, very difficult problems with arteriovenous malformations, I think that drug therapy holds tremendous
Some hope.
promise. Do you
Yeah.
agree with it?
Yeah, I definitely think it's been very effective in lab studies, and we have to see. But what we have now also is working as a multidisciplinary team to have not just embolization, but also surgery, and sometimes reconstructive surgery on top of that. So I think it really depends on where the malformation is and the extent of it, and to have a multidisciplinary team.
Yeah, so what she said is, you need to be at a center where this type of thing is being done frequently, and you can get good, appropriate treatment, not just pouring water over the flames, but trying to extinguish it.
So we have like 40 more comments, but this to summarize, Maria Fricke, her son's got a venous malformation, and she wants to know, when do you decide between laser or sclerotherapy for a venous malformation? I think that's a good question.
Yeah, it's a very good question. We actually use a combination of laser, of sclerotherapy, and surgery in patients with diffuse or even small venous malformations. So for example, if the lesion is very blue on the lining of the mouth or on the skin, we may start treatment with laser, with a neodymium YAG laser, and that will prepare the skin or the mucosa for any possible surgery if there's also a lump. If there's any deeper disease, just sclerotherapy may take care of it, or a combination sometimes of sclerotherapy where we inject it 24 hours before, and then we do surgery to remove the main lesion. But it really is a back and forth between interventional radiology and between the surgeons in terms of which treatment is useful at that time.
Michelle and I have been in communication, and she's struggling to get an accurate diagnosis for the baby. When the baby was born, they used forceps, and it was all bruised. And then they diagnosed the red part as a hemangioma, and the baby's been on propranolol, but no response. Now they're changing it and saying it's not a hemangioma, and they're saying it's just broken capillary vessels. So she wants to know where in Australia could she go, or if you know anyone where she could get an accurate diagnosis.
Yeah, there's a very good team in Melbourne, Dr. Pennington, Dr. Philip Beckor. They all work at Melbourne Children's Hospital, and they're an exceptionally good team, and they will give you a good diagnosis. So Dr. Pennington and Dr. Beckor at Melbourne Children's Hospital.
Okay, so Tracy says her 16-year-old daughter has KT, and that one dermatologist has said it's very light and that it could respond, and others have said it can't respond to laser. Are you treating KT cases if the stain is light? It's the leg.
Yeah, but where on the leg? Is it the upper part, above the knee, or below the knee?
It doesn't say.
Okay, so essentially, if it's above the knee, you can sometimes get a response. The response is not as good as we see with port wine stains, but we just do sometimes see a response. If it's below the knee, we don't see much of a response, and it's not generally worth treating because you go through a lot more pain and bother, and the response is not as good.
Carrie has a great question. Her 3-year-old son has a lymphatic malformation, but it hasn't changed since birth. She wants to know, will it stay that way? Can she expect it to change? And, what should she be doing? Should she hold off, or should she get it taken care of now? He's 3.
Where I would want to know where it's located. Does it say lymphatic malformation?
No, it just says lymphatic malformation.
Our philosophy on lymphatic malformations in general is that earlier intervention is better, depending on where the lesion is. But because we know that pretty much all these lesions do continue to grow over time, and at some point will cause a problem. So you could wait, you could see if the child gets sick and if it expands at all, if it gets swollen, and that might be the beginning of considering treatment at that point. But it really depends where it is. For example, if it was next to the airway, I would want to start treating that as soon as possible.
Well, she might write back in, but we have 52 questions in queue. Someone wanted to know what you think of ethanol embolization.
No, absolutely not. We don't recommend ethanol under any circumstances. There is one particular physician in the country who's good at it, but every year there are deaths related to ethanol, and this is our opinion. We do not believe that ethanol should be used. It's too dangerous.
There's a very narrow window of safety for ethanol, and if you pass that window, you can get cardiac arrest. You can die from treatment, and there are cases of people and children dying from ethanol sclerotherapy. So in our institution, we do not use it.
The risks are too great.
Mhm.
Now, having said that, there are one or two people who are experts, but my feeling is that you're playing with something that's very dangerous.
So Naomi has a 5-year-old daughter, Dr. O, and she has a raised hemangioma, and she's waiting for it to go down, but it hasn't. She wants to know how much longer she should wait.
So at this point, at age 5, it's probably not going to go down, or so minimally over the next 5 to 10 years that it's not. I would not wait any longer. So if it's raised enough that it's bothersome, it's causing the child to be noticed in the playground, and it's starting to affect the child's self-esteem, we would recommend taking care of it.
It's great. So Nancy has a great question. She has a 20-year-old son with Sturge-Weber and autism and a very enlarged lip. She's afraid that the surgery will be painful, but she wants to know, should she have it done?
Oh, absolutely, because the lip will continue to get larger and larger. The surgery is not that painful. We can alleviate pain, we can do lots of things, and the surgery is generally very successful. So I would say yes, get it done.
Alexander wants to know, where in Berlin can he make a contact to get his daughter seen by you?
Okay, we're at a hospital in So contact me directly, and we'll give you my email address, and I will.
It's published on here. We publish
Okay.
your contact.
Okay, so I will forward all the information. So if an email comes through to me, I will forward the information and copy you, and that would put you directly in touch.
Okay, so Eileen has a 8-week-old who has a hemangioma on the forehead. Her baby does. That's grown quite quickly in the last 2 weeks. Baby's 8 weeks old. They're being recommended at the Lurie in Chicago to start propranolol. What are the benefits of laser versus propranolol? Is the laser less risky? Can it be done this young?
So at 2 months of age, with a quickly growing hemangioma in the middle of the face, I would recommend starting propranolol. And the reason for this is that you say that it's starting to protrude. Laser is not going to touch the deep portion of the hemangioma. The laser will only penetrate 2 to 3 millimeters in the skin. So to really prevent this thing from growing, I would definitely start the propranolol. That is the first-line medical therapy of choice and the standard of care at this time. You may need pulse dye laser later on after the hemangioma shrinks and let's say there is a little bit of redness left on the skin. Then laser would be adjuvant, meaning with the therapy of the propranolol or afterwards.
The woman that wrote before about the son with the lymphatic malformation, it's in his tongue and cheek.
Definitely,
So, yeah.
definitely
I would
treat it.
treat, yes.
Yeah, because it's going to come up and cause problems ultimately. Somebody asked about
And
doctors
lately
in
we've
Brazil.
been using, for the tongue-in-cheek lesions, we've been injecting bleomycin, and it's been really, really effective.
She said hi. She's
Oh.
from Brazil.
Oh,
She
I
just
see.
said hi.
Because we know doctors, yes.
Okay, yeah. So somebody said they have a lymphangioma. Jenny, whatever you need for your baby, you can email us at VBF and we can try to help you find somebody. Tiziana said they're thankful to you. The Campbell's Boathouse. You saved my son, Owen Drager, age 14 now. Yeah, thank you.
Hi.
Rebecca Helms LeBlue, I was born with a hemangioma on my face and down my throat. No doctor would really address it. I am 60. After my hysterectomy, I was given Premarin and developed a large lump in my cheek. I did research and thankfully found a paper about them having estrogen receptors. I am so glad to have come across your paper. It was with Dr. Burrows. I don't know. So I don't know. It's probably not even an accurate diagnosis.
Yeah, maybe a
of,
venous
Probably an
malformation.
and then-
AVM
and
or a
then-
low-grade
Yeah.
AVM.
yeah. So, but we're happy to hear from you. So let's keep going down here. Well, it looks like we got caught up. And you had a lot of people from your past, Dr. Waner and Dr. O, say thank you.
I think that's an important point that Linda brought up, is that it's really important to name these lesions properly. And if you're an adult and you've had a diagnosis of hemangioma for many years and it's still expanding and getting bigger, it's not a hemangioma anymore. It's a malformation. So it's either venous, made of veins, arteriovenous, made of arteries and that go directly into veins, or lymphatic, made of lymphatic vessels. So an accurate diagnosis is very important.
Okay, so we're kind of caught up, and if I didn't answer your questions because they went by pretty quick, you can resend them. And once again, our annual conference is this Saturday at the Lenox Hill Hospital in New York City, and we turn no one away. So if you're in the area and you can get here, you can have a clinic appointment. We have 128 clinic appointments scheduled for this Saturday and over 300 people in attendance. So it's going to be pretty busy, but we will never turn anyone away, and our doctors stay until every last patient is seen. And thankfully, Dr. O and Dr. Waner will be there seeing patients. Okay, so I don't know if they're being stuck. Well, I think it's, so they pinned that, and sometimes when you pin, let me just see. Yeah, see, it's stuck.
We're having some technical difficulties.
Yeah, it's, the comments are being, oh, okay. That pinned comment is kind of blocking us from seeing, okay, here we go. So Gail says her 5-month-old daughter has one appear shortly after birth, grow rapidly to 1 centimeter, slightly raised, is very close to her mouth, but we have been told no treatment. Is this correct?
No, we disagree with that. Anything on the central part of the face that's visible and prominent should be treated. We definitely recommend treatment for that.
Mariska said her daughter is now 9 years old and the remaining malformations are at hard to reach places. Until what age will the malformations be emerging? So she must have like some multiple venous malformations.
Yeah, it's hard to comment without knowing what the lesions are, what they look like, and what we would diagnose them as.
But they can continue to pop up. They're congenital, so they probably were there at birth, unless it's blue rubber bleb nevus syndrome, in which case they can continue to crop up.
So do you use sirolimus? One of the patients wants to know.
Yes.
And which lesions do you use it on?
For very, very extensive lymphatic or venous malformations, before beginning treatment, sometimes we may start with sirolimus. If it's something that it's very diffuse, involves many, many anatomic spaces, and has risk to function, for example, to the airway.
I think it's important to state that sirolimus is just one of many ways of treating vascular malformations, and it's not usual for any one single modality to be the be all and end all, and everyone gets sirolimus. That's wrong. There are multiple modalities, and each patient should be, or the treatment for each patient should be tailored to that particular patient. Sirolimus is definitely very important in the management of vascular malformations, but it's not the only, and it's generally not used as a single modality. It's very unusual for sirolimus to quote unquote cure or get rid of the lesion. So,
because what we do know is it may decrease the volume, it may help patients with pain, but when you take the medication off, the symptoms can recur.
I think what Campbell's Boathouse is trying to say, that they were given a gel, they were probably given topical timolol to use to treat a hemangioma. What's your opinion on that?
very good.
I think it's appropriate if the hemangioma is superficial, meaning
not really
only,
raised up.
right, only skin layer, then yes. And if it's not also very large, if it takes up a large surface area, you're not going to use timolol, because the problem with timolol is that you don't know how much of it gets absorbed.
So Amanda's saying hi from Ireland. She was with the Little Baby Face Foundation, Amanda McSorley. So Naomi says it hasn't really changed in size. It's the same size as a 10 pence piece. And it's right near her eye, the baby with the hemangioma. It's raised still. Our doctors in Newcastle are saying to wait and see. Should I do next if you don't think it will change now? But the baby's still awful young.
How old is the baby?
I forgot. I think she said 8 weeks. Was she the one
Yeah.
that said 8 weeks? Yeah.
And so they saying just go through the baby's 8 weeks, and they're saying
Just it's near the eye.
I
That was
think
the
it's
one that
10
wrote
pence.
before. Yeah, and said yeah that
they should leave it alone.
yeah.
You know, anything central facial, any hemangioma that's prominent in the face, especially near an eye or near an important function, should be treated. We treat hemangiomas that are visible because we have means that are very, very safe. And I don't think any child should walk around with a big red blotch on their face. If any of you adults came to me with a big red blotch on your face and I said, don't worry about it, leave it alone, you know, it'll wait 5 years and you'll see what happens, I don't think you would be too pleased. So why should we do the same thing for our children?
Absolutely. That's our motto. We quote you, Dr. Waner. Vin wants to know if there's been any studies on port wine stain with diet and exercise. I know Dr. Comey has done the Sturge-Weber
okay.
studies with using the high protein diet for management of seizures, like to try to help minimize seizures. But I don't know of any diets for just a plain port wine stain.
Yeah, for the actual skin stain, no, but
No.
for other aspects, possibly.
Okay, Betsy Marinick Lamb said hello from Charlotte, and Amanda McSorley said, no, Naomi, my daughter had the same. Oh, there's another one through Babyface Foundation, so she was another one who helped. Orit Unger Schwartz, I know that name, from Tel Aviv, that's right. Their son has a large lower lip because of a port wine stain. I know it's just a matter of time till the debulking surgery, but at what age? He is 2.5 now.
You know, if the lip is large, then now's the time to do it. And both Dr. O and myself do go to Israel periodically, and we do surgeries there. So it is possible for us to see the child and to help the child, and we were there just recently.
And you
about
can,
a month
and you
ago.
can email me so I can put you directly in touch with Dr. O to find out when their next schedule will be for being in Israel. Hi, Kathy Francos. We haven't heard from you in a long time. Carly Miller, hi from Central New South Wales. I am 20 and have Sturge-Weber with the port wine on half my face. I had a hemispherectomy 3 years ago and now seizure and medication free. That's
Wow.
amazing.
Wow.
Amazing. But
That's incredible.
tough,
yeah.
tough. That Sturge-Weber is tough. Oh, she's 5 years old. That she just corrected me. I thought it was a baby, but it was the one that's to be. She
For
said
the
she's
eyelid?
yeah,
the
she's
eye?
5 years old. Yeah,
Oh.
that's right. Because she was saying, is it going to go away anymore?
Right.
And then
Is that the eye
yeah,
lesion?
the one that's 5.
Yeah,
I
it's
would
not.
remove
Yeah,
it
I
at
would
this point.
definitely do something.
So another question of laser versus sclerotherapy. If laser works wonders for a venous malformation, I'm not sure it does.
You know, just to try and clarify that, laser is only good for superficial lesions. It's not going to work for anything deep. So if there's a deep venous malformation, you need to do something else like sclero or surgery or both. If it's superficial, it might respond to laser treatment. Laser is superficial.
Here's a good one, Dr. O. Samantha says her son has been taking sirolimus for his tufted angioma for over a year now, and it has improved his pain. In your experience, does pain increase again after coming off of it with a tufted angioma?
We
Yeah, I
absolutely
don't know.
have. You know, there's not enough experience to be able to emphatically say
Yeah.
yes or no. So the answer is we don't know. You're going to have to try it and see.
So Clara says that her daughter is 2 and has a hemangioma in the center of the back of the left of her spine. It's changing color but not decreasing in size. Should it be starting to involute by now? She's 2.
She's 2, and sorry,
It's the
what?
center of the back of left of her
Left
spine.
of the spine.
It's changing in color but not decreasing
And
in
it's
size.
definitely a hemangioma.
You know, so it's
Okay.
it's doing what
I
it's supposed to do, I think. The only thing is, if it is a spinal lesion, was the spine looked at Was there any imaging done of the spine to see whether there are any other issues? And that's something that we typically do. So if a child presents with anything in and around the spine, we typically image the spine. We'll do ultrasound in a very young child to make sure that there's no other neurological deficit.
That's a good point.
But lightening by 2 years old is one of the early signs of evolution.
So Ashley Jackson has a good question. Her 4-month-old has a large venous malformation above his right eye, starting at the eyebrow, and is having surgery to try and remove it next month. Will he need further treatments? I like to know where that's being done, because in a venous malformation, a big one around the orbit, in our experience, there's very few places that can really remove.
And it depends if it's a
Starting
focal,
at the eyebrow.
it's a focal lesion.
If it's very superficial,
Yeah.
so it's hard to comment.
Without seeing
Without
the
seeing
imaging or the pictures, but
the extent.
you can still email us, Ashley, and I can get the email to Dr. Waner or Dr. O if you wanted to take a look before surgery. Greetings from Peru. Kristen Marie said Ella's 9 from Rochester. Her lymphatic malformation is changing and growing in her chin. As she's approaching puberty, what is the recommendations for intervention, as LMs tend to change during this time? Last sclerotherapy did not seem to create more changes.
Yeah. I definitely think, we're not locked in.
Just cancel that.
Oh, sorry, we don't know what happened. We got kicked off right in the middle of our session, so I guess we'll have to piece them both together.
So I was answering the question about the child with a chin lymphatic malformation that has not responded to the last sclerotherapy. It's time to do something else like surgery. So in our institution, that child would be considered for surgery, and for chin lesions, we get very good results. So we're happy to do that.
And something else to be aware of is that with the chin or soft tissue malformations, they can affect the bone, and over time the bone may elongate or protrude. So just something to consider, that if that happens, that can also be treated with surgery.
All right, yes, thank you, Renee. We were on and it went crazy on us and just shut down, and we weren't done. We still have 22 minutes left of this session. So I hope that you all heard Dr. Waner and Dr. O explain the importance of not allowing lymphatic malformations, especially where there's bone overgrowth, to go, especially after these kids get into puberty.
Mm-hmm.
It's just going to be much more complicated. That's why I think our philosophy of done by one can apply to almost every vascular anomaly except for AVMs. Get the babies in early and get the treatment started. Okay, so those of you who were on, there's 12 of you that are logged back in, or 13 now. I know you're all getting caught back up with us, but we still have 20 minutes, so you can still answer your questions. And much apologies, we don't know why, but the last one just kind of cut off right while we were talking. I just hope it's there so we can replay it and everybody can rewatch it again. Okay, so we have some of you back on, so let's see your questions. I'm seeing that, I'm not seeing quite, let me just see. Okay, this is not scrolling. I don't know what's happening. Let me see. I'm going to tell people to send their questions. Oops, I don't want to end it. Let's see. Oh, there we go. Okay, how often should you see a doctor for a face birthmark? Brazil timbers. I guess it depends on what it is,
Yeah,
right?
it depends on what it is. It depends on what stage of treatment or observation you're in. I think it really depends.
Oh, so someone wants to know, are steroids still used in treatment?
Very rarely, very, very, very rarely. We do not recommend steroids for hemangiomas unless the hemangioma is resistant or there is some contraindication to the other therapies. So it still is used, but very rarely.
Okay, so Gladys Farfan Townsend, I guess she's from Peru, and she said you treated her daughter in 2010 and 2018. So she's the one that's been trying to say hi to you from Peru.
Right.
Okay, so alrighty. Well, we still have some time. Like I said, well, they're building back up. You can see there's 20 on right now, but we have like 50 some on there. Renee wants to know what's the difference between bleomycin and sotradecol with injection into the orbital area.
Okay, so bleomycin is much safer. With the injection of sotradecol, which is still used quite a bit today, sotradecol is an alcohol derivative. So it's very effective and works, but it can also produce swelling, and so there is a risk of blindness with swelling, whereas bleomycin does not have that risk. The only problem is there's a limit to how much bleomycin one can have, and there is a lifetime limit on the amount of bleomycin. So they all have their pluses and minuses, but Renee, I would go with bleomycin for now. It's safer and it's very effective.
Also, Alexander wrote again about a study for the possible treatment for AVMs found. It was associated with genes at BRAF and MEK1P2. Do you know something about that? Don't know if you answered it before the shutdown.
No, do you know about that? No, I'm not aware.
We're not aware of the AVM studies, but we'd like to see them if you get it. I'm 37 and haven't seen a doctor since I was 10, but can't find a doctor close. I used to be treated with a Dr. Tina. Oh, maybe that was Dr. Tina Alster, I bet. Was that who it was? I'm not sure where you live.
Are you in Washington, D.C.? Or
Yeah.
the
Oh, yeah,
DC area?
Alster. Yeah. She used to be in Washington. She's no longer there. But we have a treatment center at Johns Hopkins. That's not far from you.
Yeah, there are several people in the
Dr.
DC area.
Antea and Dr. Cohen both. And they're on our website at birthmark.org. Hi, April. We don't know what happened. We were like 3/4 through our session. She's our social media guru. And we kind of went dead. So I don't know how we're going to work this, how this will appear afterwards. It's 2 separate ones, but we'll just let them circulate. Okay, well, we'll see you Saturday. Oh, no, tomorrow we'll see you for the free laser treatments. We have 40 people signed up with Dr. Geronimus for free laser tomorrow. So Naomi says the doctors we were under Dr. Pape at England, Newcastle says to wait and see. It's raised near her eye around 10.
Yeah.
Okay.
So that's
She's 5. We have an appointment this November.
Yeah, so that's a very conservative opinion. And, it's not appropriate for me to argue or to give an opposite or opposing opinion without having seen the child. So if you wish, you can go ahead and send me a photo. But generally speaking, we do not wait for a child at the age of 5. Anybody with a visible lesion warrants treatment. Every child has the right to look normal. That's our belief. And we will treat a child. So that's my opinion. But once again, I've not seen your child, so it's difficult for me to argue one way or another. If you go ahead and email us, we can give you a better answer.
Yeah, so that's what I was going to say. You could send an email. So Frazil, you're in Syracuse, Dr. Waner and Dr. O are in New York City. It's not far. We don't have any real experts on our website in Syracuse. Most people from Buffalo right to New York City go to the team in New York. Melissa, she said she's so excited to see you all for the conference. That is great. Her daughter is having laser treatment tomorrow with Dr. Geronimus, so that's wonderful. As we mentioned, we have 40. So where are we? We have 15 minutes left to answer some questions. It's been a great session. We thank you all for tuning in. I see we have 26 people on now. So let's get, Gail says, let me see. All right, come on, stop being so picky. All right, where's our questions? Sorry about that. Oh, she's over here. Let me just close this. Technical difficulties again with Dr. Linda. So here we go. Thank you for your info regarding hemangioma near my daughter's mouth. She also has one on her back, a flat one on her neck, both from birth, and a large one on her elbow that she was born with. Should we be concerned?
Well, whenever there are multiple hemangiomas, we should be concerned, and we should exclude liver and gastrointestinal, etc. So, and I'm sure your physician is aware of that and has actually looked into that.
Is that patient 5? Is that the 5-year-old?
I'm not sure. So Naomi, you can send the photo to the Ask the Expert through VBF, or you can send it to me and I can get it to Dr. Waner or Dr. O. So Carrie, your son that has the lymphatic malformation in his neck, cheek, and floor bed of mouth started to get blebs after he turned 2. In addition to that, he developed what a dermatologist feels is a histiocytic lesion under his arm. Is it possible there's an underlying condition that we don't know about? Is there other testing that we should look into?
No, I don't think the two are related, but the bottom line is the lesions that you're talking about in the mouth and oral cavity are very treatable. We treat that with a simple injection of bleomycin and we get exceptionally good results. We do not believe in waiting because ultimately it is going to get worse. So earlier treatment is better.
So Annie Beats says, does bleomycin and ethanol embolization have the same result? Sclero and ethanol embolization.
So we know that ethanol is very, very effective, but with its 100% or very high effectivity comes again this risk of death. So, and other complications that are, causes significant morbidity. Bleomycin is effective. It likely is not as effective as alcohol with just one injection, but it is very effective. And patients have been seeing results. We've been seeing results. So we would, and with fewer risks, obviously. So that's why we use it. It causes less swelling in the airway when we use it for airway lesions and for orbital lesions.
That's great.
So it's a safer treatment, much safer, and the results are good.
So Julie said her son's got some scarring from laser treatments. What's the best way to fix that? Probably port wine laser treatments.
So it depends on the scarring where it is, but the main laser we use for that is CO2 fractionated laser.
So Claire, you can just call Dr. So they're in Birmingham, England, and she wants to know if she can self-refer. She's the one that her daughter had the hemangioma back by the spine.
Yeah, absolutely.
Yeah.
We're not in the NHS system, so you can self-refer. You don't need a referral.
So Colette says she has a venous malformation on her leg, and doctors say there's nothing else they can do for me. She's only had 3 sclerotherapy foam. Can you suggest anything? I'm 31 in a lot of pain.
Generally pain can be treated. Dr. Rosen is exceptionally good. And most patients who come to him with vascular malformations of a limb and pain as a symptom have responded very nicely. So I would see Dr. Rosen about this.
Okay. Yeah, I was going to say that too. And too bad you couldn't come to our conference Saturday, because Dr. Rosen will be here seeing patients for free from 1 to 6 p.m. at the Lenox Hill Hospital. So we have about 10 minutes left for some questions for some people who haven't been able to ask their questions. Not sure if you've seen my comment, but was wondering if it is possible to have pain in the birthmark because she complains it hurts her sometimes. It hasn't bled yet, but she has knocked it and it does bruise around it. I'm not. Yeah. See, when these questions come in broken, and there's so many coming in, we can't put them together. We can't piece together who's what. So you have to kind of state what the birthmark is and how old your child is.
It's definitely possible to have pain in a vascular malformation. For example, in a venous malformation, you may get clotting that happens. And if it's very extensive, you get continual clotting. And so that can cause pain. If it affects some of the sensory nerves, patients can complain of pain in that area. So it depends on the malformation.
This is an interesting question that Carrie Martin asks, and I'll be interested to hear how you both answer it, because she wants to know, like, how much reduction in redness can you see with the use of propranolol for a hemangioma?
You know, it's very, very variable. It varies from child to child. In some children, all the redness goes and everything goes, especially with early treatment. In others, there's very little response. However, it's known that the redness does not always respond to propranolol, and that some residual redness can be left at the end of treatment. This almost always responds to pulse dye laser treatment. So once again, a combination of treatments is very important, and that any physician should not be one-trick ponies and just use propranolol for everything or sirolimus for everything. There are multiple modalities, and it's important to be able to use these. So if there is residual redness at the end of propranolol, then that's an indication for laser treatment.
What about timolol? If it's gone flat, then it obviously responds, right, to a beta blocker. Would you try timolol?
I mean, you can try timolol, but timolol, the question of whether topical timolol is any different from systemic, in other words, taken by mouth or propranolol, we don't really know the answer. And
That's a good point.
We really don't understand these things, but we do know that laser works.
We also know that when we look at our patients who are on propranolol therapy, it's very effective, but up to 50% of kids at the end of propranolol treatment may still need something else. They may need laser for any residual redness, or they may need surgery for any residual lumps. So that's important to know that propranolol is not the end all.
Well, not just a lump. Sometimes they deflate, like when you let all the air out of a balloon and you get this hanging skin. That's never going to go away, right? Unless you remove it.
Especially the mushroom-shaped hemangiomas.
Right. Annie Beat said, thank you. Would you suggest for a patient whose MRI imaging shows improvement for the lesion, it's a lymphatic malformation, but the affected area is the same large size?
That's what we typically see. We see the effective area is the same, but the actual size of the lesion improves. So once again, you can continue with sclero or consider another modality. It depends on who you're seeing.
Margaret Whipple-Deuce said she just wanted to say hello to Dr. Waner. She was a patient of his at Arkansas and am now in internal medicine pediatrics hospital. So
I'm a lot older than I was.
She has Kupeltranane and was diagnosed with a spinal cavernoma. Is it likely part of the syndrome? I would think so.
Yes.
So there's Renee again. Hi, Renee. Several treatments throughout my years. I got small pea-sized clots that are painful. What is this caused by, and should there be a concern of the clot to move to other areas to cause a stroke?
So these clots don't move. They typically stay where they are, and so they're not the same as a clot, say, in your thigh or your calf. Those are dangerous, and those can move. These clots don't move. What causes them is the abnormal flow of blood through the malformation, and this abnormal flow causes blood clotting, and they become very painful, and then eventually they settle down, but they do not travel. They're not dangerous clots.
Oh,
when we go in and do surgery on these venous malformations, sometimes they're full of Leaflets and clots, and the Leaflets are really stuck into the vessel wall. You almost have to really pull it out. They're not just sitting there mobile.
So Naomi just reminded me that she's the one with the 5-year-old that has the little hemangioma left near the eye, and she's the one that says when she bumps it, it hurts. So is that related?
Generally not. Hemangioma is not. The biggest problem that we have is that we can't, kids can't really describe what's going on effectively to us. So we don't even know. We think that actively growing hemangiomas are probably uncomfortable, We know that ulcerated hemangiomas are very uncomfortable. We can see this from the reaction of the child, but we don't know if there's any pain associated with it, so we can't answer that effectively.
Okay. So Kristen wants to know, Kristen Marie, is age a factor in people's response to sclerotherapy?
Generally,
No,
no.
not that we know of, no.
Samantha said, do tufted angiomas increase in size during adulthood?
They can, yes.
Zainab Eid says, hello, Dr. Waner. I got a surgery with you last year, and I got a 5 bleomycin injection after that, and it has a good result, but it's still a little bit large because of the past YAG laser sessions distortion. How to treat this? I guess she's wondering.
We need to.
Yeah.
Hi, we'd love to see photos, and can you send us an email with some information, and then we can answer you specifically.
Yeah, and April has posted Dr. Waner and Dr. O's emails throughout the string, and when we log off in 4 minutes, you can go back and re-watch this, re-listen to it. All the comments stay. We leave these indefinitely. We have them up since January of 2017 on Facebook and also at birthmark.org. That is our website for VBF is birthmark.org. And you can click on to watch the videos, and they're all there. We have like 20 of them now.
Yeah, just as a comment now, just for the last few minutes, I think it's very important for for the people to realize that there are multiple modalities, and that this is not a one-trick pony type treatment, and that any institution should have all these modalities at their disposal in order to treat it effectively. And that's very important.
And is there anything else you'd like to say in closing, Dr. O? Like, do you feel still that there's a lot of inaccurate diagnosis going on, and that's why it's so important that we continue to educate?
Yeah, no, definitely. I think one of the main take-homes is that it's really important to be plugged into a good center where you have people who are thinking about vascular anomalies all the time, not just 1 or 2 a year, and to get a really proper diagnosis, and then to have options for treatment. So it's not just one thing. It may be one thing to start, and then a year later, it may be another tool that would be best for you. So it's important to get a diagnosis because that opens you up to all the options for treatment. And that things are always changing also, and to be able to keep up with what's out there at a given time.
And, one last thing, there are lots of new drugs that are being developed. And so I think the next frontier in the treatment of vascular malformations definitely is the advance of certain drugs. At the moment we have sirolimus, but there are certain families of drugs which are looking very, very interesting. And I think fairly soon we'll find out more about these.
Yeah, and I'd just like you to close with a comment that still a lot of our parents of children with port wine stains and hemangiomas are told nothing should be done, just leave them alone, they'll go away, whether it's a port wine or a hemangioma, and no matter how big it is. We don't subscribe to that philosophy, so what can these families tell their doctors?
Yeah, I think, any child has the right to look normal, especially in today's age. We can do a lot for these children. No children should be disfigured and left alone. If any adult came to me with the same lesion, they would not accept that.
All right, well, we're going to close now, and I want to thank you, Dr. Waner, and thank you, Dr. Owen. We're very proud
And we want to thank you,
Thank
Linda.
you.
very proud to have you on. So
And
thank
we're
you
happy
all,
to be
and
with you.
remember, you can re-watch these videos anytime you want. And next month, we will be doing Sturge-Weber syndrome with Dr. Comey again, right around Thanksgiving. So stay tuned. Thank you all.
Goodbye.
Thanks, bye.